Good morning, and thank you for joining us for this important conversation during PCOS Awareness Month. I'm Jamie Weiss. Last week, we explored what polycystic ovarian syndrome is, the symptoms to look for, and I even shared my personal experience with PCOS. But it was important for me to expand the dialogue past our newscast. That's why we brought together a roundtable of experts to get answers about the disease and get you answers about PCOS. This morning, I'm honored to be joined by Dr. Michael Leidick, a OBGYN reproductive endocrinologist with University of Kansas Medical Center. Claire Walsh, a registered dietitian with Clarified Nutrition in Leawood, Kansas, and Casey Donor, a vice president for Casey Infertility. That's a nonprofit founded here in the Metro to help those affected by infertility. I just want to thank all of you for joining me today for this really important conversation. So we want to remind you at home or at work, if you're joining us, this is a live stream. We want you to be a part of this conversation, so you can send us your questions on Facebook or on the YouTube stream, and we'll get those answers for you right now. But I want to go ahead and start things off with what is polycystic ovarian syndrome. For that overview, we're going to send things over to Dr. Michael Leidick. Michael, good morning. What is PCOS?
PCOS is a hormonal condition that causes someone to not ovulate, not have regular menstrual cycles. It also has metabolic implications, as later on it can lead to an increased risk for hypertension, diabetes, stroke, and certain cancers. And also it may cause infertility because it may prevent ovulation. Some of the signs of it could be, of course, inability to have regular cycles, signs of extra male hormones, what we call androgens, like testosterone, for example. These can cause symptoms like acne or unwanted facial hair, body hair, that's noticeable, cosmetically noticeable.
And Dr. Leidick, you were also telling me there are different types of PCOS. Can you explain them? You said they were phenotypes?
Yeah, we call them phenotypes. So phenotypes are just, the word phenotype just means outward appearance. That's different from genotype, which is how your genes program you to be. So there are 4 different outward appearances that are described. The one that we hear about the most is the one that has all of the symptoms. It has the evidence of extra male hormones like facial hair, acne, loss of hair on the head, irregular cycles, and the polycystic appearing ovary on ultrasound.
So you say the name polycystic ovarian syndrome. I think a common question a lot of folks may have, myself included, is polycystic ovarian. Does that mean I have a lot of ovarian cysts? What does that mean in terms of PCOS versus ovarian cysts?
Well, polycystic ovarian syndrome is called that because when you see the actual ovary, let's say on an ultrasound, you'll notice little tiny cysts that are along the border of the ovary. And these are not large cysts. These are not ones that look abnormal or that are going to, grow and burst or cause cancer. I think a lot of folks are worried about, they hear the word cyst and they're, distressed by that. But I think it's just it's named after that observation of these tiny cysts. And those tiny cysts are called antral follicles. They're where the eggs are located. And they're naturally just there. It just so happens that they're arranged in a particular pattern that you don't see in everyone.
It's really interesting to have you break that down, that typically women could see something like this even if it's not PCOS. It's just a normal part of womanhood, of female life. Would you say PCOS is a lifelong condition?
I would say yes and no. No, because it sort of ends with menopause. When menopause happens, there's no longer really ovarian function. So part of the things we use to diagnose PCOS, like irregular periods and not ovulating, those are no longer in the picture because you don't do those things in menopause. However, there's a metabolic component to this. Like I said earlier, if you have extra male hormones, you have a condition called insulin resistance. Those can persist into, later years. And I think that insulin resistance is a kind of a common pathway to a lot of the things that make people sick when they're older. hypertension, diabetes, certain cancers, stroke. Those are all kind of a result of insulin resistance kind of over many years.
And going off of that, Dr. Leidig, what would you say what are the treatments for PCOS? What do they look like?
It depends on what you're trying to achieve. So if you're trying to achieve getting pregnant, it would probably be some lifestyle changes like dietary modification, weight loss, but it would also be fertility drugs to help someone ovulate. You can't get pregnant if you don't ovulate. So that's a key part of that treatment. But if we're talking about just managing PCOS for someone who doesn't want to be pregnant, then the first line treatment is birth control pills, because birth control pills will regulate the menstrual cycle. It will kind of suppress some of that male hormone that's being produced. And by doing that, it controls a lot of the symptoms. There's a lot less facial hair acne, hair loss, things like that.
Okay, and one thing I was wondering, we've seen GLP-1 use explode over the last year. Is that an option for women with PCOS?
That is an option for women with PCOS. I think a lot of women with PCOS have struggle with weight loss. We all say that weight loss is very helpful in the condition, that losing somewhere between 7 and 10% of one's body weight may help someone to ovulate more easily. However, it can be a real struggle to lose that 7 to 10%. I have patients that tell me they do everything possible and they're very diligent about it, and they still cannot lose weight, or they plateau and then they stop losing weight. So anything that gives them an advantage, such as a GLP-1 drug, and that makes it happen quickly, can be really helpful.
And so when a PCOS patient is told, maybe one option for you to manage your PCOS is to make a lifestyle change, that can typically mean diet and exercise. I want to bring in Claire Walsh, registered dietitian. Diet and exercise, what does that look like specifically when you talk about PCOS?
Yeah, that's a great question. I typically approach these lifestyle changes in three different buckets: food nutrient interventions, physical activity interventions, which can include exercise, but it's not just exercise. It's specifically being active for heart rate increases or muscle growth, and then sleep stress interventions. And all three of those make a big difference from an insulin resistance blood sugar management perspective. Usually when we're looking at the food side of things, we're thinking about, is someone meeting their nutrient needs, whether that's total energy or calorie intake, protein, specific nutrients based on different kind of lab panels that we might run, or look at their labs that they've had with their physician. With physical activity, one of the things we know makes a really big difference with insulin resistance is building muscle tissue. So we can work on some strength training, and if that feels inaccessible to someone, which I totally understand, then we can work on little bouts of activity throughout the day. 5-minute walks after meals make a big difference with blood sugar regulation throughout the day, things like that. And then as far as sleep and stress management goes, one of the other things that plays a big role in affecting our blood sugar is how much sleep and how high quality that sleep is that we're getting. And then stress. Cortisol, the stress hormone, has a function of raising blood sugar, so we have to bring that into play as well. Make sure we're not constantly on the go and really activating that stress response, because that can also wreak havoc with blood sugar regulation. So those are the three areas that I typically focus on with my patients.
Yeah, you bring up a lot of really good points there, and it's hard in a sense to have to keep so many things in mind of, I need to make sure I'm getting exercise, I need to make sure I'm eating properly to make sure I'm managing my blood sugar. Are there certain foods women with PCOS need to avoid?
I love this question because it's one of the most common questions that I get, and the answer is no, technically no. So research has not shown that eliminating any specific foods is beneficial for PCOS management itself. However, there are a number of commonly kind of coexisting conditions like irritable bowel syndrome or hypothyroidism that, depending on the individual's symptomology or etiology, that may benefit from limiting or avoiding certain foods if you have one of those things. And getting hypothyroidism or IBS in better control may contribute to better PCOS management. So technically, no, but it depends on the person. And sometimes it's some of the other conditions that may be contributing to their inflammation, or hypothyroidism contributes to metabolic issues in general and can cause someone not to ovulate. Those may be helped by eliminating certain foods. That's more person dependent though.
Well, I guess on the flip side of that, is there any sort of superfood or any type of food that you would recommend for women with PCOS?
That's another good question. I don't know that I would say a superfood necessarily, but one of the nutrients specifically that I see people really have big energy and cravings and sleep improvements with once we start incorporating this more regularly is making sure that we're getting enough protein at each meal and snack, and every time we're eating a source of carbohydrate that we're having a protein with it. So that doesn't mean necessarily that you have to drink protein shakes or only eat chicken. That's not what we're going for. We got to have the two together. It's the carbohydrate and the protein combo, and spreading that throughout the day that makes a really big difference as far as a lot of PCOS symptoms go.
And I feel like that's attainable too. It's not like you're saying, like you said, you need to have a protein shake, a protein bar every hour of the day. It feels somewhat attainable with what I think a lot of women maybe already have incorporated into their diet. I want to move on to this question that I would love to have each of you weigh in on, because I think for a lot of times when women receive this diagnosis of PCOS, there can just be a lot of emotions. There might be validation that, hey, I knew something was wrong with my body, but there's also maybe some uncertainty about the future that this diagnosis can bring. It's also isolating. So Dr. Ladek, I want to start with you, and we'll kind of go around here. But why is mental health an important factor when treating PCOS?
It's been shown that people with PCOS may have more issues with depression and just just depression due to the disease. It can cause difficulty sleeping, so some will have sleep apnea, and as a result of sleep apnea, you don't sleep well, and that can affect your mood and just your overall sense of well-being. So I think it is really important to recognize that and acknowledge that, and I think making the diagnosis helps people to understand what's happening to them, and that gives them, I think, a little bit of closure about, what's been going on all of this time.
And Claire, I'd love to get your perspective. It looks like we may have lost Casey for a few moments. We'll wait to get her back, but Claire, I'd love to hear your perspective on this.
Sure, yeah, disordered eating, body image concerns, anxiety, depression do occur more often in women with PCOS than in the general population. So as far as what that means for us as providers, it's really important that we consider those things as we're making recommendations for someone who has PCOS, especially if we've got a little bit of other disordered eating risk factors in life. And just throwing out maybe you should lose some weight it's not a zero harm recommendation, especially if we've already got some body image concerns. So that's where responsible nutrition counseling really comes into play, and making sure that we're listening. A lot of my patients come to me saying they feel as though they've been struggling for a long time and it's taken quite some time to get the diagnosis, and they don't feel heard. So that's one of the things that we really need to focus on being better about as providers.
Okay, I think that is so key there, what you're saying there, Casey, is just making sure that women are heard, they are understood, because that is so critical, especially when dealing with something like this. So we're gonna get to Casey in just a bit. Oh, Casey, perfect timing, you just came back here. We're just weighing in on the mental health impacts of PCOS and why mental health is an important piece of treating PCOS.
Perfect. I was diagnosed in my early 30s, and so I had never heard of it before.
It sounds like we're having a little bit of technical difficulties with Casey, so we'll get back to her in just a moment. But I do want to move on to this other question, sort of related to what I know Casey can really speak to, which is how does a diagnosis of PCOS impact fertility, and does having PCOS make having kids harder in the future? So Dr. Leidick, we'll start with you, and what is the infertility implication of PCOS?
Okay, well, it does make it harder to become pregnant because, again, without ovulation or regular ovulation, you can't become pregnant. So often the first line that we will try is a fertility drug. And there are two different ones that we often start with. One is called letrozole, the other is called Clomid. Clomid's been around a really long time, and I think everyone knows of it. Letrozole is sort of newer, but letrozole is actually the better drug for PCOS. And these are both oral medications. They're both inexpensive. They're low risk. They don't have a lot of side effects. They don't cause anything like cancer or birth defects. So these are easy to use. They're relatively cheap, and they're easy to take for a few days early in a cycle and can often get someone to ovulate. And then once they're ovulating, it's easier to become pregnant.
And I mean, it's good to know that there are options, and it's not just you have PCOS, you can't have kids. It just maybe makes the journey to having kids a little bit more difficult, or just not as clear of a straight line. Casey, we've got you back now. Wanted to just check in with you about what is Casey infertility, and you were starting to share your PCOS story with us. All right, we'll try to get back to Casey in just a moment here, but Casey is a board member of Casey Infertility. They are a local nonprofit that was founded with hopes of connecting other members of the Kansas City community who have gone through infertility struggles, not just polycystic ovarian syndrome, but other causes of infertility. So that has been something that they have been able to bring people together. They do a support group each week, just building on that mental health aspect. So really important to be able to bring everyone together. One thing I did want to ask, this was a question that we've received as well, and Dr. Leidick, you sort of touched on this, but does PCOS ever go away, and is there a cure for PCOS?
PCOS does not go away. It's something that I would say is lifelong. As I mentioned earlier, when menopause arrives, there are no longer ovaries functioning the same way. So part of the components we use to diagnose that are gone, but it is a lifelong condition, and the best thing that we can do is just try to manage it. I often tell patients that when it comes to managing it, we either have to decide we're going to get pregnant or we're going to manage the PCOS. It's very hard to be in the middle and be in that middle ground where we say, well, if we happen to get pregnant, then we do. Because without ovulating regularly, what often happens is we don't become pregnant and we continue having irregular cycles, and there's just it's a tough spot to be in. So I think we often have to make a black and white decision of we're either going to use fertility drugs and become pregnant, or we're going to use something else to manage the symptoms and the menstrual cycles.
And it's a hard decision. It's a hard conversation to have. And I think it's a lot to process. And that's why I think it's great that we're having this conversation now. We are maybe making it a little bit easier to start these conversations. We want to give a reminder to everyone that this is an open discussion. So if you have a question, we want you to come to our KMBC9 Facebook page or our YouTube, and we want to bring in some of these viewer questions. So I know you touched on this a little bit, Dr. Leidick, but is there such a thing as postmenopausal PCOS, and what would symptoms of that look like?
I don't think we would call it postmenopausal PCOS. We might give it a term metabolic syndrome. Polycystic ovary syndrome and metabolic syndrome are kind of related. Metabolic syndrome is where someone has any number of different findings like high cholesterol, hypertension, an increase in the measurement around their waist, or obesity. So these all kind of intersect with PCOS, and PCOS often is strongly connected to metabolic syndrome. So again, when you take away the ovarian function part of it, you have these symptoms of metabolic syndrome that can last into the menopausal years. And someone with PCOS may have still those androgens, those male hormones being produced. So that can, of course, give someone facial hair acne, loss of hair from their head, kind of like temporal balding, like we see in men. And that can persist into those menopausal years.
I appreciate you explaining that, Dr. Leidig. Another question that we have received from Facebook, I believe, or this may have been Instagram. If you are not trying to get pregnant, is there a benefit to seeing a reproductive endocrinologist versus a regular endocrinologist?
I think either one is a good option. I think that medical or endocrinologists or internists are very tuned into this nowadays and very good at treating it. So I think really either one would be good.
And can you just explain the difference between a reproductive endocrinologist and just a regular endocrinologist?
A reproductive endocrinologist starts out as an obstetrician gynecologist. So we train an OB/GYN for 4 years, and then we have a fellowship that's additional training in just the endocrinology of women's hormones and menstrual cycles and infertility and those types of things. A medical endocrinologist is actually an internal medicine specialist who does additional training in just general endocrinology.
We have another viewer question that's come in from Instagram. Casey, I think, I don't think we have Casey at this moment, but Claire, I want to go ahead and direct this one to you. This question coming in from Instagram is, where is the intersection of holistic medicine and food when it comes to treating PCOS?
Yeah, that's a great question. A lot of the patients that I work with have a real interest in trying to treat things holistically. And I feel like, there's a term that the oncology or the cancer treatment world has used for a long time that I think really applies well here, and that's complementary and alternative medicine. We know that medications like birth control or fertility treatments can be extremely helpful for managing symptoms, but we also know that those things sometimes work better when we have a good foundation with the food, the physical activity, and the sleep and stress management things. So I see them really working together. One of the things that I do a lot with my patients is really focus on making sure that we're figuring out what are some of the underlying drivers of their particular symptoms. Do they have insulin resistance? Do we have higher inflammation happening globally? And do we have a hyperactive stress response? And when we can narrow in on what some of those drivers are of the PCOS symptoms, then we can be a little bit more specific about what we're trying to accomplish by using some of that holistic functional medicine stuff and using foods to help manage PCOS symptoms.
That's a really great perspective, Claire. I appreciate that. And it looks like we may have gotten Casey back. I wanted to give you a quick moment just to share a little bit more about Casey and fertility. All right, well, we'll try to get to Casey before the end of this live stream. We do have another viewer question that's come in on our Facebook page. This is, can birth control mask symptoms of PCOS? I apologize, this is coming in from Instagram. Dr. Leidig, where does birth control sort of stand with PCOS? I know you touched on it a little bit earlier as a possible treatment method.
The answer is yes, it can mask symptoms of PCOS, and that's actually why we use it, because it is a way of controlling those symptoms. It doesn't really get rid of PCOS. It in a way does sweep it under the rug, but it does improve some of those symptoms. So because the birth control pill has estrogen and progestin in it, kind of like a synthetic progesterone, it can control the menstrual period so that someone doesn't have irregular cycles and abnormal bleeding. And at the same time, the estrogen that's in the pill can suppress those male hormones, those androgens, and keep them low. And it kind of quiets the ovary during that time. And because it does that, there's less acne and hair growth where it's undesired. So it's a good way of protecting you from those symptoms of PCOS while you're taking the birth control pill.
And what about for women who maybe they're only a year out from trying? Maybe they get their diagnosis and maybe they weren't ready to start planning for kids, but that diagnosis makes them reconsider. what would be the course of action in that situation?
I would say that they could go to their OBGYN provider or someone like me, and we could talk about going off the pill, and then how do we plan for them to become pregnant. And they can always go off the pill and try, but I think that many who go off the pill and try, they sort of end up seeing us in the long run anyway. And then that's where there's a role for, making lifestyle modifications and using fertility drugs. I don't think anyone's touched on it here, but there's also a drug called metformin, which is it's a diabetes drug, but it also reduces insulin resistance, and about 40% of women who take metformin may begin to ovulate spontaneously. We don't always know who that 40% is going to be when we give it. It's sort of we have to wait a few months on the drug and see who responds best. But some will use metformin, some will use supplements like inositol, which is an over-the-counter supplement that's been shown to be helpful with PCOS. So these are all just tools in our toolbox.
And I want to keep continuing this conversation because I feel like we have a lot of really good information here, but I also want to make sure we can share a little bit just from each of you. Do you have any advice for women who are trying to speak with a doctor about their fertility but get shut down? This is unfortunately the last question we're going to have time for today. I'd love to hear from each of you. Dr. Leidick?
I would say if you feel you're shut down, you may need to speak to someone else and get another opinion. You shouldn't be shut down. I know that many years ago there was a study that said it took up to 5 different doctors to make a diagnosis of PCOS, because it is tricky, I think, to diagnose it in a young person. In teenagers, for example, or those going through puberty, they may have irregular cycles just because of puberty, and it may be chalked up to, oh, it's nothing, it'll just go away. So it may take a while sometimes for someone to recognize this and see that pattern that is PCOS. But I feel like if you're not really being heard, you should probably get another opinion.
That's a really great point. And I would love to ask, Casey, while we have you for a moment, can you speak briefly about what is Casey Infertility?
Casey Infertility is a local nonprofit. We specialize in education support, and we also do yearly grants. Like you spoke of earlier, Jamie, we do have a conference coming up on September 20th at Johnson County Community College. And you can find all the information on that conference on our Facebook page and Instagram page, which is Kansas City Infertility. I apologize for my connection errors. I guess that's how it works sometimes.
It happens, and you know what? This goal of this live stream is just to spark the conversation of to bring more awareness to polycystic ovarian syndrome. September is, of course, PCOS Awareness Month. We know that 1 in 10 women have this diagnosis, but about 70% of women are undiagnosed. So that's why it's important for us to come together today and just spark that conversation a little bit more. I know there are more viewer questions that came in that we don't have time to get to, but I do want to quickly ask each of you to share what is the best way to get a hold of you if they have questions. Dr. Leidick?
I'm at a practice at 435 in Null. We're called Advanced Reproductive Medicine with the KU Women's Health Group. And you can reach us at 913-588-2229.
Claire, you are a dietitian. There's Dr. Leidick's information. If you'd like to get more information, you can also find them at kansashealth.com. Claire Walsh is a registered dietitian. You can get in touch with her on her website, clarifiednutrition.com. She's also pretty active on Instagram too, if you want to get a hold of her. And then we were able to hear from Casey Donor with Casey Infertility. She mentioned they've got a conference coming up in just a couple of weeks focused on helping build families. It's not just for women with PCOS, but for any families that have maybe struggled with infertility. So you can find more information about Casey Infertility on their website as well. So again, I want to thank all of the panelists for taking time out of their Monday morning to spend time with us, answering important questions, and just continuing the conversation during PCOS Awareness Month. If you missed out on any of our reports about polycystic ovarian syndrome, you can head to KMBC.com. You'll find much more information there. We've compiled a list to try to help viewers learn more about this disease and their next steps. So again, we want to thank all all of you for joining us during this important conversation about PCOS Awareness Month. I'm Jamie Weiss. Have a great day. Local news continues at noon.